Hi, welcome to the second episode of A Quick Bite with Dr. Stadium. We've really enjoyed the feedback we've gotten from the first episode and all the questions received. Please keep them coming. Today's episode is going to piggyback a little bit off of that first episode. My brother David had a great question regarding his 9-month-old of, when can I start seeing teeth, or what teeth should I see at what time? So I'm going to go over, a few kind of age groups and what to expect. So one cool thing about teeth and when they erupt is these teeth are starting to form even when that baby's still in utero. So those baby teeth that you're starting to see maybe around 8 months old, sometimes 6 months old. It can vary a little bit, but those teeth are actually starting to form when that baby's actually still, in utero. So I'm going to go over an x-ray here you see of a kid that's around 7 to 8 years old. And I'm going to pinpoint a few things that I see. So first off, the first teeth we see usually on a child are what we call our 6-year molars, which I have circled here in red. An interesting thing about these teeth is they start forming when your child is born. So, these teeth are forming, developing for quite a while before you actually see them. If this isn't the first tooth you see in the mouth, don't worry, it's not a big deal. But this is usually around 6 years old we see that tooth. Next, we go to the teeth that we usually see next, which are our incisors, our teeth in the front. We usually see the ones on the bottom, the first two in the middle, on the bottom first. But again, that can vary. And we usually see these somewhere around 7, it can be up to 9 years old, those start coming in. This is another reason why we talked about in the first episode, we want to see your child around that age so we can make sure that everything, the eruption is going normally. One of the big questions I get when I take this x-ray is, what are these teeth up here, up here and down below? And those are actually more permanent teeth you're seeing that are still sitting right above those baby teeth. So when we take this x-ray, what we're really looking at a lot of times is not necessarily the ones that are in already, but these ones that are forming and they are starting that eruption process. I pinpoint here on this x-ray, this is a canine, which is one of the biggest culprits of kind of getting off track. And so, around 7, 8 years old, we love to have this x-ray so that we can see, are these coming in properly? And if they aren't, we can do something as simple as taking out some baby teeth, which can help us avoid a surgical procedure in the future. So our goal is, the least invasive, as possible. And so, these x-rays can be very valuable and why we want to, have you in at that time. So I'm going to also include here in the comments a couple of tables, a couple of charts that are going to show, if you have any questions about, my kid is, X amount old, when should I expect to see teeth? And so this first chart shows baby teeth and kind of when to expect to see them. Again, I want to stress, if your kid is not getting them right at this time, don't worry. This is a lot of times a good time to contact, your dentist, your orthodontist, your pediatric dentist. Ask them if you have any questions. A great way of keeping communication there. The next chart is going to be one that has the adult teeth. And so, again, these are just rough estimates of when we usually see those teeth. But if you have any questions, I'm more than happy to answer them. This is going to conclude our second episode of A Quick Bite with Dr. Stadium. Please list any questions. If you want to direct message me those questions, I'm happy to answer anything. Again, I hope you guys are staying healthy, staying home. I hope to be able to see the patients again soon. And I'll leave you with this last saying: is a smile today can go a long way. So thank you again and have a great day.